Guess who's back doing his best Chevy Chase impersonation on a long family road trip? Dr. Craig DeLisi, I'm glad you went to where you went and got back safely. Good to have you back in the mix. How are you?
Thank you. Doing well. Thank you. Glad to be back.
I bet you are. It's always good to get away, but boy, isn't it nice to pull back into the home? He's like, okay, I'm home.
It is. It certainly is.
Well, I'm glad to get you back on the air. Dr. Craig DeLisi with Titus Regional Medical Center and the Family Care Center. Our first chat in August. So I took a peek to find out what we are to be aware of in terms of health this month. A couple of things I want to bring to listeners' attention. Breastfeeding. So new moms, the advantages of breastfeeding versus going straight to formula.
I'm a big fan, proponent of breastfeeding, like most physicians are. I think breast milk is sort of, I always tell moms it's God's perfect food for their particular baby. So it's, formula isn't poisonous or terrible, and I think certainly when women can't breastfeed or can't make enough, it is a good alternative. But, breast milk provides, a perfect balance of what the baby needs. It provides things that formula can't, such as passive immunity, antibodies, and things like that to help protect the baby as the baby's immune system's forming. I think it also helps with bonding between the mom and the baby, and then, another benefit is that it helps the mom's body in the recovery. It helps her uterus shrink down a little quicker. It does pull calories out of her body, so it helps her get off some of the extra weight gain during pregnancy. So it's just, in every way, in my opinion, superior to other forms of feeding the newborn. And thankfully now I think it's pretty much universally encouraged. Hospitals, when they give birth, they really try to strong arm the moms a little bit into doing it, especially if they're hesitant. And, thankfully most moms are able. And so I really always encourage moms to give it a try, even if they're a little resistant or nervous. I think it's still the best thing for the baby.
Is there any danger in, say, storing breast milk, freezing it? Can you freeze it?
Yeah, so there's the rule of fours, and you can, breast milk, if you pump breast milk and don't use it, which a lot of women will do that, or put it in a bottle and feed that way, it can stay out for 4 hours in room temperature and be fine. It can be in the fridge for 4 days, or it can be in the freezer for 4 months. So women who are really strong milk producers are making more than they need and are pumping and storing. They just need to label the bags. And I have some that, goodness, make milk like a Jersey cow. I mean, they'll fill up a deep freezer and then fill up another deep freezer. And sometimes that can be a problem if you can't get to it in time. And so, I have women that even will bank it or send it to, places that can, donate it to NICUs and things like that. And so, but it's still good as long as you follow those principles.
And the last topic with breast milk. So, post-birth, how much gets transferred from what a mother's food, drink intake gets transferred into that milk into the baby? In other words, if you were very conscious and did not say drink during pregnancy, but now you got a baby and 3 months in, you're going to have a toddy or two. Can that get passed on?
Very little, of the things we eat and drink. I mean, for medicines and including, things like alcohol, there are slight amounts that are passed. And for medications, you can actually look that up on a given medicine. Say, hey, I have a headache. I want to take this. Is this safe with breastfeeding? Alcohol in moderation is fine. If someone wanted to have a glass of wine or two or a beer or something while breastfeeding, that's not a complete no-no. If you were drinking heavily, then that probably would pass a bit more through the breast milk. That could be concerning. But as a general principle, the healthier and the better the mom takes care of their body, probably the better that is for the breast milk. But, in some cases, I think moms are afraid to do anything or eat anything that they shouldn't, and I think sometimes that's an unnecessary degree of attentiveness because, it's very microscopic amounts of things that pass through.
We're talking with Dr. Craig DeLisi with the Family Care Center, Titus Regional Medical Center. Speaking of kids, not toddlers anymore, off to school they go, and I'm assuming that's why August is our Be Aware of Immunizations Month because the kids going back to school, a lot of schools expect these kids to be immunized. In fact, they make sure you are. And I know this is a delicate topic, and you're a very likable guy. And just talking immunizations might mean some people aren't going to like you after this conversation. Yeah. How do you dance around what has become a controversial topic?
Yeah, I try to keep it pretty simple. I tell people, my position on vaccines is pretty much always been the same. I really consider vaccines, I'd call it a 1A and 1B tie as far as the medical inventions of the 20th century that have had the biggest impact on health and mortality and morbidity. There's no question that it's the invention of vaccines and the invention of antibiotics, in my opinion. And so I think vaccines are an incredible blessing. I think they're unbelievably beneficial for everybody. Now, sadly, one of the fallouts of COVID, and I think it was really just because of the mandate of the COVID vaccine, because I also think the COVID vaccine is a helpful vaccine. I've gotten every time that it's time for a booster. I think it sort of took vaccines. Prior to that, there were some people who had hesitations and concerns about vaccines, and I'm happy to discuss those with patients. I do frequently. A lot of it's misinformation, and some of it is just differences in opinion. But prior to COVID, I don't think it was as big of an issue. But sadly, after COVID, I think vaccines have become more of a kind of almost a political topic and something a personal. Almost like a issue of personal preference and not being told what to do. And I think that's what happened. I think because people were told what to do, they initially pushed back against it, and now we're seeing fallout even with other things. But I usually just try to tell people, hey, if I'm your doctor and you trust me, let me give you my medical opinion on these. I'm not doing it for any personal gain or financial gain or because I tease that you don't have to turn in your Republican voter registration card if you want to take a vaccine. It's not something that one political party should do more than others. But I think that they're really helpful. Not all of them perfectly prevent illness, although some do incredibly well. But all of them do prevent a high percentage of the illness. And then if you ever do obtain the illness, your body's acting as if it had previously been exposed to it. And you have a response that makes the infection that you get hopefully much lesser. And that's true for all of them, including the flu vaccine, which I also take every year, my kids take every year. So I really think it's just a medical issue. It's not a personal liberty issue, although I do agree that, me or someone else shouldn't be telling someone you have to do this or that thing, and I don't do that, but I definitely give my strong opinion. So, people will disagree with that, and I think that's fine, but I try to be respectful to their thoughts and opinions, and hopefully, if they trust me as their doctor, they'll listen to mine. But I'm a very strong proponent of vaccines, and I've had the opportunity to go to parts of the world in East Africa and South Sudan where vaccines are scarce. And I tell you, a world without vaccines is something that we would be terrified of. I've seen kids die from measles, die from preventable forms of meningitis, an adult worker die from tetanus. And, the first time I came back from a trip, probably 15 years ago, I wanted to kiss my family, and then I wanted to come kiss the vaccine fridge in our clinic, and just out of gratitude that we don't deal with these things here. And so I think they're wonderful.
Dr. Craig DeLisi with the Family Care Center, Titus Regional Medical Center. Good to have you back in the mix.